Hello everyone and welcome to this short video where I'm going to be discussing the role of gut health in psoriasis. So my name is Alex Manos. I am one of the co-founders of HealthPath and I am an Institute for Functional Medicine certified practitioner with a background in nutritional therapy. So I have a master's in personalized nutrition and a degree in nutritional therapy. I'm host of the HealthPath podcast. And I actually have a personal history of psoriasis, which is interlinked with a history of chronic SIBO, hydrogen sulfide issues, large intestine issues, a relationship between all of these things and stresses over the years. And I've had sort of leaky gut in the past, which obviously is to some degree a natural consequence of all of these things. And I highlight just that because I think it's important to appreciate that I have that personal experience and that understanding, and therefore I can relate to potentially what you are going through. So the objectives of today are to summarize the research around psoriasis and gut health. It's that simple. And I think it's important to always take that step back. Although today's video is primarily talking about gut health, I don't want to give the impression that the gut is the only thing that contributes to psoriasis. When you dive into the research, it becomes very obvious that there are many factors that can all accumulate and contribute to someone being diagnosed and suffering with psoriasis. And those include specific infections. Our body composition can impact our risk of psoriasis. Various environmental toxins may be contributing to our condition. Medications have been associated with psoriasis, obviously poor diet and an excess intake of alcohol. Stress has been associated with psoriasis in slightly different ways. Some research indicates that stress may act as a trigger to a flare-up in psoriasis. Other research indicates that stress may actually be associated with the severity of the psoriasis, or actually our relationship with psoriasis may contribute to us experiencing more stress. Nicotine has also been associated with psoriasis, but today the focus very much is on gut health. Before we dive into that, and somewhat related to it, I did want to highlight some of the infections that have been discussed in the research in regards to psoriasis, and you can see them listed here. Perhaps the most well-known one from a psoriasis perspective being Candida albicans, but you can see types of chlamydia, the human immunodeficiency virus, hepatitis C, Staphylococcus aureus, Porphyromonas gingivalis, and beta hemolytic streptococci. These have all been discussed as potential triggers to the condition. So we want to be mindful about these infections. We want to be mindful of our immune system and the state of it and how well modulated the immune system is. And this is one of the reasons why there is quite a lot of research around stress in this area of health as well. Now, when thinking about gut health, we can break it down into a few different components. So there is research looking at the gut microbiome and dysbiosis, which is largely referring to imbalances within our large intestine. There is research looking at the metabolites that our gut microbiome are producing and whether imbalances or changes to the metabolites might contribute to psoriasis or help improve psoriasis. Gut inflammation has been associated with the condition in a small study. SIBO has been connected. Leaky gut is a common theme within the research of psoriasis and something that we certainly see clinically as well. And then there's research talking about potential celiac disease or undiagnosed celiac disease and gluten sensitivity as well. So when we think about large intestine dysbiosis, the research essentially shows us that this is a significant part of the condition. There's a little bit of a chicken and egg argument in regards to the research, in the sense that do imbalances in our gut bacteria contribute to psoriasis, or do the things that contribute to psoriasis create an imbalanced microbiome? And I think often when we're sort of on the topic of the chicken and egg argument, it's not black or white or one or the other. There's a combination of the two. We know that the immune system helps regulate the microbiome, and a healthy immune system will allow for a healthy microbiome. And these are bidirectional pathways. A healthy microbiome helps modulate a healthy immune system and an appropriate immune response to things like infections. So it's not either or. We have to be thinking about the gut microbiome, but we have to be thinking about it within the context of the overall person and all the other elements of physiology that can be modified through nutrition, lifestyle, and when needed, medications. Interestingly, the diversity of the microbiome, which has been discussed a lot on this YouTube channel, has been associated with psoriasis, and again with contradictory findings. In some research, diversity seems to be lower in patients with psoriasis. There is one study which reported greater diversity in patients with psoriasis. So it's not necessarily a marker that we can use with any real clarity when we're doing things like stool testing. What is very clear, though, is an imbalance in the microbiome is very prominent. So then the question becomes, well, what might be contributing to those imbalances, what we refer to as dysbiosis? And there are some very well-known things, such as courses of antibiotics over our lifetime. A poor diet may contribute to dysbiosis, and that might be something, for example, which is very high in processed refined carbohydrates, a diet that's lacking in adequate diversity or dietary fiber or polyphenols. And these are plant compounds that really give food their color. So when we're thinking about polyphenols in our diet, we're really thinking how colorful is our diet. Nutrient deficiencies have been discussed in the research, and we'll be looking at that in a future slides. But interestingly, even things like urban versus rural living, air pollution and other pollutants within our environment. We've talked about stress and how that's associated with psoriasis. Well, one of the mechanisms might be via its impact on our gut microbiome. And we've also already discussed the bidirectional relationship between our gut and us as the host of all of those different organisms and bacteria within the gut. So if we are not healthy for whatever reason, it's unlikely we're going to have a healthy, well-balanced microbiome. We know that systemic inflammation, for example, contributes to imbalances within the microbiome. The microbiome and imbalances there contribute to systemic inflammation. Most of these things are not a one-way street. Now, I did want to come back to stress just for one slide, because the research here on psoriasis I find really interesting, fundamentally. This paper discussed how the authors found that the research suggested that stress is not associated to an increase in symptoms, but an increase in the impact the symptoms have on our daily life and well-being, which I thought was an interesting way of thinking about this. It means that we may need some form of additional support as we work our way back to good health, if we're finding that the symptoms are actually creating a lot of stress, because that then may have a knock-on impact on our ability to improve the condition. So we can end up sometimes in these vicious cycles whereby stress can contribute to the symptom can contribute to our distress, and we therefore need to work on both parts of that cycle. Leaky gut is something that has a little bit of research behind it in the context of psoriasis. And what I will say over the last sort of 13 years of working with clients with psoriasis is it's an incredibly common finding. Studies have indicated that almost the majority, around 50% of people with SIBO have leaky gut. And if you have inflammation within the large intestine, for example, if you have low microbiome diversity, a lot of the things that we've been discussing today may impact the integrity of that gut lining. So if you're not familiar yet with this term leaky gut, it's really referring to the gut lining and how permeable or leaky it is. Now, the gut lining is designed to be permeable. It's designed to have a little bit of leakiness there. In fact, it's essential that we have that. So when we refer to this leaky gut syndrome, we're really referring to the fact that the integrity of the gut lining has become compromised. And there is the translocation, the passage of unwanted particles from the gut into circulation. And this can be various bacterial metabolites, partially undigested protein particles, and things like this that can trigger an immune response. That immune response causes systemic inflammation, and inflammation may contribute to psoriasis in those that are genetically susceptible to the condition. Then we have SIBO, small intestine bacterial overgrowth. There's actually, again, not a huge amount of research looking specifically at psoriasis and SIBO. What there is seems to suggest that psoriasis, as well as rosacea, may benefit from the treatment of SIBO. And that is because a subgroup of people with psoriasis are found to have SIBO on SIBO testing, and treatment of SIBO in those participants leads to improvement in their psoriasis symptoms, which is pretty strong evidence that a subset of people with psoriasis have an overgrowth of bacteria in their small intestine and therefore should be treated for that condition, because we see in the studies that psoriasis improves. In a different study, they did some testing, and essentially they found that 60% of patients and 3% of controls had altered absorption, or essentially had malabsorption. So when we look at this 60% of participants that had psoriasis, 6% were found to have celiac disease, 21% were found to have bacterial overgrowth, 3% had parasitic infections, and one patient actually presented with eosinophilic gastroenteritis. So again, more evidence indicating that SIBO is somewhat of a prominent component within psoriasis. And then we can look at microbial metabolites. So most of us now are very familiar with the concept that the gut microbiome is an incredibly important, sometimes referred to as organ within the body, and that it can be modified through various lifestyle interventions such as diet and exercise. Many people are now aware that we can test the gut microbiome to see how much of specific bacteria, parasites, yeasts are within the large intestine. However, we can't currently get a lot of information around what those organisms are doing within the intestine. It's one thing to say you have this amount of this bacteria present. It's another to say you have this amount of this bacteria, and this bacteria is producing this amount of metabolites. And in this state-of-the-art review looking at psoriasis and the gut microbiome that came out this year, in fact, in 2021, they showed that participants with psoriasis had a depletion in short-chain fatty acid production. That is something that can be routinely tested for in various stool tests that are on the market now. Short-chain fatty acids are metabolites of certain bacteria, one of the most prominent ones being butyrate. And butyrate is an anti-inflammatory, immunomodulatory fatty acid. It helps maintain the integrity of the gut lining. So therefore, having appropriate production of short-chain fatty acids, such as butyrate, is important in maintaining a healthy gut lining and therefore preventing leaky gut, so to speak. But other metabolites were found to be out of balance, so to speak, as well, including one we refer to as TMAO. And these two metabolites seem to be the most significant findings concerning gut physiology from a metabolite perspective and psoriatic patients. And then we mentioned earlier inflammation. So as I said, this is a very small study, 10 patients, but 60%, 6 of them, were found to have elevated calprotectin, which is a marker of gut inflammation. So again, something we really want to be ruling in or ruling out if we're struggling with this condition. So these are the things that we can consider. Imbalances within the large intestine or the small intestine. How are the bacteria behaving in regards to microbial metabolites? The integrity of the gut wall, referring to leaky gut, and whether someone may have celiac disease or gluten sensitivity. So with that in mind, what are some of the actual testing options that are available to us at the moment? Well, we can go and do microbiome testing. We can consider a stool test to look at things like microbiome diversity and the distribution of the large bacterial families within the large intestine. Within those same tests, we can look at what we refer to as some of the functional markers. So we can look at calprotectin to see whether there's inflammation within the large intestine. We can look at zonulin, a marker around intestinal permeability, aka leaky gut. We can look at things like secretory IgA, which gives us an indication of your mucosal immune system. The mucosal immune system is part of the immune system that lines your digestive tract. It is very much there to help balance a healthy microbiome and to ensure that you're mounting an appropriate response to all of those bacteria within the large intestine and to the food that you are consuming. And these tests often will look at pancreatic elastase, which is a marker to really see whether you're producing enough digestive enzymes from the pancreas or not. If this marker comes back low, that's indicating a degree of maldigestion, and further investigation may be required to help you understand why that's occurring. In our experience, one of the most common causes is in fact SIBO, small intestine bacterial overgrowth, but things like celiac disease, as well as pancreatitis, inflammation of the pancreas, can also contribute to low pancreatic elastase. We can do SIBO testing. SIBO testing is a breath test. It might not be the easiest test to do in the sense that it is a 3-hour test where you're taking a breath sample every 20 minutes to be evaluated for the level of hydrogen and methane gases that you're exhaling after having consumed a sugary beverage at the beginning of the test. We've got lots of resources on SIBO testing and treatment in our YouTube channel. I've spoken to the world experts such as Dr. Becker and Dr. Jacobi, so I'm not going to dive into SIBO in any real depth today, but you can go and look at those podcast episodes which are on our YouTube channel if you are interested in learning more about SIBO from a more general perspective rather than specifically for psoriasis. Generally speaking, if you have a hydrogen positive breath test, we normally see that associated with looser bowel movements and diarrhea. If you have a methane positive breath test, that's been quite strongly associated with constipation in the research. There are always outliers who don't fit that kind of typical clinical picture. So don't worry if you've done a test and you have a different sort of experience from a symptomatic perspective. It does happen, but that is the general trends that we see. You can also do leaky gut testing. This is a urine test. It's a matter of collecting urine over a 3 or 6 hour period. And again, you've drank a little sugary solution to see how much of those particles are being detected in the urine. And that is a way of evaluating the integrity of your gut lining. Those are all tests that you can do in the comfort of your own home. So it's either taking a stool sample from a bowel movement, doing a breath test, or doing a urine test. Now, when it comes to nutrition, ultimately this needs to be somewhat tailored to you. So for example, if you are found to have a bacterial overgrowth in the small intestine, something like a low FODMAP diet may be one of the more appropriate diets for you to consider. But if you have an imbalance within the large intestine, we need to understand what type of imbalance that is, because there are 3 categories of dysbiosis in the large intestine. You can have a bloom or an overgrowth of pathobionts or potential pathogens, i.e. bad bacteria or organisms. This could be related to a parasitic infection or a candida overgrowth or certain bacteria which at certain levels can become problematic. But you could have a loss of commensals, where you're actually lacking some healthy bacteria, what I sometimes refer to as a bacterial deficiency. Or you may have just a general loss of diversity. Your diversity score has come back low. While there will be some overlap between these three sort of dietary approaches, they all may come with their own slightly unique personalized interventions. For example, if you have a parasitic infection with Blastocystis hominis, which is one of the most common parasites in the UK, for starters, that may or may not be contributing to your symptoms. There's research indicating that garlic and ginger have anti-parasitic properties specific to that parasite. But it may be that there doesn't need to be a significant change to your diet if you're already eating a healthy, diverse diet. Whereas if you have a significant overgrowth of Candida albicans, that may come with its own dietary requirements. So you can start to tailor the diet a little bit based on the type of dysbiosis that we see. Fundamentally, we want to be seeing adequate levels of dietary fiber. We want to be seeing plenty of prebiotic foods such as Jerusalem artichokes, garlic, onions, asparagus, the list goes on. And we want to be seeing plenty of polyphenols, so lots of color within the diet. Everything from coffee and green tea through to grapes, peppers, olives, olive oil contain plenty of polyphenols. I guess the personalization can come partly down to what are you reacting to? Some people with SIBO, but also with large intestine bacterial overgrowth may find that they're reacting to some of those prebiotic foods, and therefore we may need to reduce those a little bit before we start to sort of consciously integrate them back into the diet. There is some specific research around nutrition and psoriasis though, and you can see a relatively long list of nutrients that we can consider that have been shown to be helpful. Omega-3 fatty acids from things like salmon, sardines, and mackerel. Vitamin D from sunshine or from supplementation. Vitamin A, especially retinol, which is the preformed vitamin A compared to, let's say, beta-carotene, which can be converted to vitamin A in a subset of the population. Some of us are genetically predisposed to having a reduced ability of converting beta-carotene from orange foods in particular, like carrots, for example, to retinol, the primary or preformed vitamin A. That vitamin A comes from cod liver oil or liver, for example. Eggs can be a good source of it. So again, if we are lacking some of these animal produce, for whatever reason that may be, we just need to be mindful of whether we're getting these nutrients or not, and what is the best form of food or supplement so we can do our best to ensure that we're getting these nutrients in adequate supply into the diet. But other things to consider: vitamin B12. We've mentioned short-chain fatty acids such as butyrate. Butyrate is produced by the fermentation of dietary fiber by our bacteria. Hence, we need adequate levels of dietary fiber. Now, without wanting to overcomplicate this, there is some research indicating that we can produce subtypes of butyrate on things like a ketogenic or carnivore diet. And this may explain why some people have experienced profound improvement in skin-based conditions by moving towards one of those two diets. Selenium, genistein, dietary fibers, probiotics, they've been shown to ameliorate or improve psoriasis because they pretty much all, via different mechanisms, may have anti-inflammatory and immune modulating properties, especially with a specific immune cell called regulatory T cells. These are often referred to as the quarterback in the American football team, who are, I guess, helping, how should I put this? They are helping manage, they're helping, I can't think of the word, let's go with manage the team. They're the director, so to speak. We've already sort of touched on the relationship between psoriasis and gluten sensitivity and celiac disease. In one study, what was interesting was in an open label study where 30 patients with psoriasis who had elevated IgA antibodies to gliadin, a protein compound within the gluten grain, or within gluten, were started on a gluten-free diet alongside medication for 3 months, followed by a normal diet. And what they found was that after stopping the gluten-free diet, in over half of the patients, psoriasis was exacerbated, indicating that, again, for them, the reintroduction of gluten into the diet led to an immune inflammatory impact that exacerbated their skin condition. So we're talking 18 out of 30 people, over half of the patients, and therefore I think it is really worthwhile considering trialing a gluten-free diet if you have psoriasis. There is a good chance that it will improve your condition based on the research. We've mentioned probiotics a few times already. There is a systematic review looking at both the oral and the gut microbiota in patients with psoriatic disease. And they basically found them to be quite helpful, even though they didn't change the microbiota at a structure level, indicating that there was probably a change in the relationship between the microbiome, the immune system, and us as the host. In one of the primary studies that this review looks at, the probiotic that was used was omnibiotic stress repair that contains these 4 probiotics or bacterial organisms. So I thought I'd give you the specifics in case you were interested in trying to locate this probiotic. But bear in mind that in my experience, there are lots of different forms of probiotics or probiotic products that can be helpful. So don't feel that you only can use that one probiotic. It really indicates that other strains are likely going to be very helpful. And my conversation with Dr. Jason Horolak on the Health Path podcast recently really confirms that, which I think is we can use probiotics quite specifically, and that can be partly based on symptoms. There are specific strains of bacteria that are better for diarrhea, others that are better for constipation, others that are better for bloating, others that may be better for anxiety. The list goes on. So when we think about psoriasis potentially also being an autoimmune condition, and therefore wanting to help modulate and regulate the immune system, there are going to be many other strains of bacteria that can be helpful in that situation. So thank you for listening. I hope this sort of short video summarizing the role of gut health in psoriasis with the testing options that are available to us has been helpful. If you have any further questions, don't hesitate to reach out. You can contact us via our website. You can book a free consultation with our team via our website, or just leave us a question or a comment below the video and we'll get back to you as soon as we can. So thanks for listening, and I hope it's been helpful.